Hey, I'm Matt Stricherz. I have a real name that's Mathias. And when I was a kid, it was Mathias Ernest Richard Stricherz. And with the family I grew up, my nickname was Pope Pius Mathias. But little did they know, that was a public side of me. It wasn't the real side of me. So I'm going to kind of let you know a little bit about me. I actually grew up in South Dakota. I was a bit of a hellraiser. I was an alcoholic by the time I was probably 5 or 6 years of age. I grew up in a mentally ill family. My folks probably, once they realized what the family was like, say that they could have been family members for me because of my acting out behavior. My world changed after I dropped out of college and joined the Navy. I was in Southeast Asia and had an event that I quit being a man and I became a human being. Spent a couple of years, did some search and rescue, my last search and rescue. Within about 2 months of that, I got sober from all kinds of things. And within 2 months of that, I quit having DTs and I quit having certain kinds of things. And I think it kept me from having the bad kind of PTSD that many Vietnam vets did. And I got involved with LSD drop-in centers. I got involved with Alcoholics Anonymous. I got involved with community support groups. And over the years, I've done several things besides going to college and getting a doctorate. Was an actual police psychologist and worked the streets. I spent 28 years in the Navy Reserve, 4 years active. I also developed a belief that students needed to really get involved in understanding alcohol and drug issues with other students. And I developed the nation's first 24 hours a day alcohol poisoning and drug crisis team, and the first accredited alcohol and drug program at a university in the Midwest. And with my background, family, personal, and then working with students, working on the poorest reservation in the United States, and now coming to New Mexico, it seems like nothing's changed in a lot of ways when it comes to the kinds of issues that we face. Right now I'm the supervisor of psychology for the Adult Psychiatric Division of the New Mexico Behavioral Health Institute, and that means I work every day. Get up in the morning, go to work, sometimes work after hours. I may have met some of your family members. You may have heard them talk about me. If they say nice things, it's true. If they say bad things, it's true. Everything our clients say we have to take with that belief that some part of them, they believe it. Tonight I want to talk to you about co-occurring disorders. A co-occurring disorder comes from us in many ways. It used to be called the double trouble disorder. Some of you have maybe heard of double trouble groups. New Mexico was one of the last states to pretty much get rid of the phrase double trouble because it meant double trouble. I'm going to get my glasses so I can read what I wrote here. A doubling trouble label, stigma, what a person experiences when they're told they got a dual diagnosis. And it was also double trouble, 2 times hard to heal. 2 times as difficult to maintain medication adherence once a person left a hospital or once a person kind of weaned themselves away from an outpatient program. 2 times as difficult to the family to provide support because it's hard to figure out, is that person in front of me right now somebody who's high, somebody who's using, somebody who has got a secret that I can't figure out why they're acting different, or is it the mental illness? What is it that is presented right there in front of us? As well as 2 times the energy to support that person. Okay. Co-occurring essentially means it's the chicken and the egg. Families sometimes have to figure out, did this person really have schizophrenia or schizoaffective or a psychotic disorder? And then later on they find out that the person was drinking, doing methamphetamine, doing extra Ritalin or a whole bunch of extra Ritalin, or playing the Skittles game. How many of you know what the Skittles game is? Medicine cabinets have all kinds of pretty colored pills, and sometimes junior high kids, late grade school kids, and high school kids all bring a little bit from mom and dad's medicine cabinet. They put it in a bowl, they go to a party, they lie to you, they say that they're going to the game or they're going to do something else, and they get together, they drink a little bit, and they take some Skittles. You know, like the candy Skittles, all these multicolored things, and they play that. It changes the brain, it changes who they are. Well, usually we don't find out until we go into the medicine cabinet looking for our own meds and, I don't remember taking those, and they're gone. Some parents find out they had a child who had been using since age 8, 9, 10, or 11, or 12, whatever it might have been. The smallest group, the youngest group that I've worked with substance use has been 7 to 12-year-olds, and that was doing work out in California. Fully diagnosed substance users in treatment through family court or through the Navy system. So sometimes we have to figure out, are we looking at the chicken, what presents to psychiatry, or are we looking at the egg, what was fertilized and grew inside of a shell, and it came out. Looks like a chicken, walks like a chicken, clucks like a chicken, but maybe that egg is something else. Maybe that egg had alcohol or methamphetamine or something in it. So part of our job is to figure out, do we have the right diagnosis? So dual diagnosis, we wonder about it. There are some common factors that people say are part of dual diagnosis, common factors. And one of the things we know about common factors for people who often develop substance use disorders is they may have an antisocial personality, maybe a borderline personality disorder that accounts for some increase in their dual diagnosis. Okay? And then there's the secondary substance use. This is called a supersensitivity to alcohol or drugs. Some of us have mothers and fathers or grandfathers and grandmothers, uncles and aunts who may have had a substance use disorder, so we may get, as part of our supersensitivity, a bit of genetics that say, Mark, can I use you for just a moment?
You bet.
Mark's an okay person, no family background with substance use at all. He's got to drink a whole lot, or he's got to do a lot of meth, or he's got to smoke a lot of dope before he gets addicted. Now Matt's got a supersensitivity. It takes about this much, where it takes a barrel for you. Supersensitivity. And so my genes turn on with a roar. Now I've got the genes for mental illness, I've got the genes for liver disease, I got the genes for a problem with my kidneys, metabolizing, oxidizing drugs and all, and I've got the mental health stuff, the substance stuff. It may not take much for me to become a full-blown, dually diagnosed or co-occurring disordered person. And that really raises havoc in the family. The other one is there's a second psychiatric disorder model, and that is some disorders themselves give rise to a certain kind of drug that feels good. Methamphetamine feels good because it raises levels of dopamine in the brain about 7 times higher than a great kiss would raise it. It gets us excited. It is aimed at that. There is a particular drug, dimethyltryptamine, out there that really targets one cell in the brain, and just a little use, it goes from my belly button to my head, from my nose to my toes, from my lips to my fingertips. It really makes me want to have that euphoria that sometimes comes with grandiosity, sometimes with paranoia, sometimes with that bipolar expansion. So I'm going to have a little bit more of that stuff because I'm not cycling in my bipolar, but this stuff makes me really, really feeling great. Mom, Dad, don't bother me right now. You're going to ruin my trip. You're going to ruin how great it feels. I'm going to go out and dig that hole to China in the backyard. Like I said, I can do it. And I know I can do it. Trust me, I know I can do it. And there's all of that stuff that we see with just bipolar, but now the substance is exacerbating or imitating a bipolar. I do want to tell you one thing now, that the research does not truly support on co-occurring disorders. There is minimal research that says people with bipolar disorders self-medicate. I was always taught growing up when I studied alcohol and drug that those of us that have certain kinds of emotional problems or depression or whatever, we medicate to feel better. No, we medicate to get high because it feels good getting high, and it can help us with what is good inside of us, or we feel like it does, so we medicate ourselves. But you know what? If I say I'm self-medicating, then you're going to take a little bit of sadness for me, and you're going to probably want to get me to a psychiatrist so I don't have to self-medicate. But I don't take the pills, and I keep using the substance that helps me feel good or normal. Every disorder that supposedly we can diagnose has different symptoms. Some of them look like other symptoms, and virtually most of the drugs and alcohol we have in this country can imitate, with extensive use, any of the mental illnesses. These are the classes of drugs, okay? We have alcohol, you all heard of that. We have caffeine. Do you know that caffeine is a wonderful stimulant? And chocolate candy bars also have another amphetamine in it called phenylethylamine. Did you know that that takes place when you're in love and you look at somebody and your heart goes, oh my goodness? Or when we use a fair amount of phenylethylamine in chocolate. Have you ever known somebody who was depressed really like good, dark chocolate? It's an upper. Can you get addicted to chocolate? Oh yeah. Can you get addicted to Dr. Pepper? Oh yeah. Sometimes you have to start your morning with a cup of coffee. Caffeine. Cannabis. Marijuana. When I was growing up, this was called dope. Everything else was called drugs. I grew up in an age in the 60s and the 70s. I went to war in a place where instead of smoking marijuana the way everybody else did, because everybody else thought everybody else was smoking marijuana, we were smoking marijuana and opium at the same time. It was all laced. Our pilots would sometimes fly when they were high on marijuana and opium. We did search and rescue on marijuana and opium. We did our job with marijuana and opium. And if we ever had any injuries then, morphine didn't do the job. So we got a lot more morphine than other people. It was really a great thing during that time frame without us realizing what was going on. Hallucinogens, PCP, and others. The most common hallucinogen that you will have in your home is Robitussin, NyQuil, certain cough drops with dextromethorphan. You use the right amount and you can get really high. When a young person with a co-occurring disorder says that they miss being able to do LSD or peyote or mescaline, and they start drinking 4 bottles of Robitussin a day, they end up with a substance-induced schizophrenia episode, bipolar episode, psychotic episode. How many of you knew that non-opioid tussin that gets you through a cold really has a very powerful dissociative hypnotic in it? It's a really interesting drug. Inhalants. There used to be a saying out there that you never see an elderly inhalant abuser because they die. Their brain doesn't work, okay? But some people to this day that I work with that are 45 and 50 years of age say that they're still craving going out and buying gold spray paint or silver spray paint. But they're embarrassed to go into some of the places and ask somebody to unlock the cabinet so they can get their high. Inhalants. And then we have the opioids. They in themselves can create cravings for some of the newer opioids that are way stronger than heroin. There's a few new drugs out that they say are about 1,100 times stronger than heroin. I don't know if you all have experienced much of that in the community here. I do know that we've had folks from this region who have tried some of those drugs. And then we have the sedative hypnotics and anxiolytics, the benzodiazepines, those things that really kind of make you feel good and buzzed and gets rid of the anxiety. Your heart doesn't rush anymore. You just feel kind of in the zone. And some people remember the hippie days of the 70s, where when you're in the zone, you felt like doing the spaghetti dance. You felt like you were going to truck. You just had that groove on. And you know? Yes, sir.
Sorry, but I'm curious, would Suboxone
Yes.
fit this category?
Is it?
Suboxone.
Suboxone, yeah, it's an antagonist. It works to help do some craving. And do we have people crushing it and snorting it? Yes. Do we have people buying it on the street? Yes. And they have an exacerbation of their psychoses, or of their bipolar, or of their depression. Or then they go back to stealing, breaking into houses, selling things out of the house. Some of their personality stuff comes up, yeah. You've heard of Suboxone?
Oh, yes.
Yes. When it's used with a really good prescriber, it can be very helpful. Very helpful. Then we have our stimulants, methamphetamine, Ritalin, all those kinds of things, Dexedrine. Tobacco. Rarely do we get a mental illness that is triggered by tobacco use. I've seen maybe 2 in 40 years. And that was when somebody wanted to not only chew, but they ate almost a pound a day. They got psychotic before they ended up in the emergency room with an overdose, a nicotine overdose. And there may be some others. We have lots of new kinds of drugs out there. But these are the classes of drugs. Now, cannabis can cause psychoses. Caffeine can cause psychoses. Alcohol can cause psychoses. Hallucinogens are psychosis inducers. Inhalants causes psychoses. Opioids can cause psychoses, and certain of them can cause psychoses that will last and last and last. Our sedative, hypnotic, and anxiolytics can cause psychoses, but they usually don't. Our stimulants absolutely cause psychoses because they cause sleep dysregulation. Our tobacco generally is considered a wonderful brain drug, but the delivery mechanism is dangerous. Okay? So these are the kinds of drugs we see out there on the street. We're going to talk about some of the drugs that are kind of new drugs that imitate some of those old drugs. Co-occurring disorders, a substance-induced mental illness can be caused when a person is withdrawing from a prescription drug, and on the street drug, a drug they make in their own home. They can have all of these things: psychotic, bipolar, depressive, anxiety, sleep disorder, a delirium, and what looks to be like a dementia on withdrawal, on the intoxication phase, or maybe if they are using a prescription antipsychotic, antidepressant, or something like that, it can cause an exacerbation. Here is an example. Can I use you, Luz, for just a moment? Just pretend that Luz has a bipolar disorder. She once was given Zoloft. She took the Zoloft, and all of a sudden, her brain lit up. She felt good. She started being able to study better. She felt like she was 6 foot tall and bulletproof. She became really manic. People at work noticed that she was working twice as hard as anybody. She volunteered for 3 or 4 shifts in a row, all from the effects of Zoloft. And what happened? She crashed. Everybody noticed it. She had a full-blown substance-induced bipolar episode from a drug that was given by a reputable and very careful prescriber. Okay? So medication-induced. These areas there are sometimes what we see with the people who have been nicely medicated but then started using some substance on the side that you may or may not know about. This is one of the things that we're really going to be struggling with soon. Just because it isn't illegal, and now new cannabis with cannabis cards, that doesn't mean that that substance is good for you. That doesn't mean that it helps with reality functioning or testing or production. And it certainly doesn't mean that it can be defined as having some positive reason for its use, other than it feels good to use that kind of drug that's legal. If I said I really like drinking a bottle of Robitussin before I go to bed because it gives me great dreams and I don't have any pain in my body and I sleep really good. And then the 4th night that I use a bottle, I have to have another bottle at 3 o'clock in the morning to get back to sleep. Okay. Just because it's illegal doesn't mean it's good for us. And it cannot be considered biogenic. It can't be considered as adding something good to our life. Language matters to the person that has a co-occurring disorder. And these are a lot of the names that go hand in hand with co-occurring. Some of them are pretty negative names. Some of them the people call themselves, I wish I had a nickel for every time somebody said, well, I'm just a nut job. I've been schizophrenic for 29 years. And they're 40 years old. They had the first break when they were 9, 10, or 11. Basket case, crazy, alcoholic, drug addict. And you know, language matters. And there's all kinds of reasons that people in general, not just people that have mental illness, but y'all and I, why do we use psychoactive substances? Sometimes peer pressures, sometimes we use it for medical, sometimes we just want to experiment with it. Okay? Experimenting with drugs have helped develop many different street drugs. We continue because it does relieve stress and pain. Some people function better with psychoactive substances. Some people cannot control a bipolar disorder unless they have a mood stabilizer, or possibly an antipsychotic, or perhaps something else. Does that make sense? We need drugs with all the changes we have in our world, and to cope with our mental health disorders. And it feels good. It absolutely feels good. That's really exciting. I want you all to remember these formulas, and you can go home and make spice, okay? I don't know what happened here. In a nutshell, 2010, NIDA said, after repeated drug use, deciding to use drugs is no longer voluntary because drugs change the brain. I'm going on close to 48 years of sobriety from all drugs. I got a little bit sick, and somebody in an emergency room, I told them I didn't use opioids, so they gave me methaqualone. For 3 days, I refused to leave the house because I was feeling as if I was way back in 1970 and 71. If it doesn't change the physical brain, and very often they change the physical brain, it changes our memory and changes our craving brain. Okay, let's see what we got here. Just want to talk about Synthetic drugs. We have three kinds of synthetic drugs. We have the psychedelic synthetic drugs. We have synthetic stimulants. Methamphetamine is actually a synthetic stimulant. Ecstasy is a synthetic stimulant. And we have synthetic, what people call cannabis. There is no marijuana in synthetic cannabis. How many of you knew that? There's zero marijuana in that.
Do you mean THC?
Say again?
THC?
THC. In synthetic cannabis, there's no THC, there's no CBD. It's called spice, it's called K2, it's called incense, it's called funky monkey some places, it's called Zohai, like I'm Zohai man. It's got all kinds of slang names, but there's no marijuana in it. But it changes the brain very quickly. Okay?
Thank you.
You're welcome. It was actually manufactured at Clemson University in 1995. It hit the street, and lo and behold, some really professional human beings called Air Force people discovered it. They were in the Minuteman missile silos in places in Montana and North Dakota and Wyoming, and their work went downhill. They were passing their drug tests until one day somebody goofed. And one of the airmen spilled the beans that he had been bringing in spice, letting his friends use it, and they lost a lot of their abilities to perform. So some states outlawed it, and the chemists then changed the chemical in it just a little bit. So that one was illegal, but the other one was illegal. And then they changed that one, and that one, and that one, until we have like 14 or 15 variations of the chemical that's spice. When we find somebody who has a psychotic disorder or extremely manic disorder, and they do not seem to be responding to the regular medications, we make sure we have a good substance use assessment on them, and we often find one of two synthetic drugs. Spice is one of them, bath salts are another one of them. Okay. Synthetic marijuana creates massive physical danger, it changes the brain, and that changes into psychological danger. Bath salts, synthetic amphetamines, creates psychological danger because it is such a rev up. It is made to imitate a leafy substance that is used by many people in battle to stay awake for days, causes psychological danger. When people don't sleep, they have sleep dysregulation and their brain plays tricks on them. That's called psychoses. And it will also cause physical danger because of the violence it creates. I guess you can't see that very well. Now, these are lists of all of the names for synthetic substances. You have them in your deal. If you can't see them, I'll get you a big copy of them. I can get those to you, Tom? Yeah. Okay. So we're just going to say there's a whole bunch of them. This is what spice looks like. The first time I saw spice, I got called to a suicide attempt. A guy had a gun. I walked into the place. This was up north, and there was a little kid alongside a coffee table licking wrappers like this. First thing I did was I had the police take the kid out, and then I realized I'm not up against somebody who's suicidal. I'm up against somebody who's completely unpredictable, because synthetic cannabis changes the brains. We have less ability to think clear if we would use it. We have less rationality, less logic. And if you are my mom or dad and you've discovered that I have bipolar disorder and I'm using spice, there's less likelihood I'm going to pay any attention to you, because I don't have to, because I'm better than you. Besides that, I feel pretty good. And I'm maybe going to fight the people that you take me to, the ER or Community Guidance Center or someplace like that, because there's aggression with it. It's the nature of that. It's not really spice, it's not really a bath salt, it's not really incense. Synthetic amphetamines are called bath salts. They're called bath salts because it was connected to a girl on TV who used to do the ivory snow deal in the bathtub. She was covered with foam. They used that marketing label that almost looked like the ivory label when they first came out. How many of you knew that? Older people recognize the ivory girl. Younger people don't. It's chemically based. It is not plant derived. Because it is chemically based, and you can get, people that want it can get recipes on the internet for it. They can go to supermarkets, drugstores, farm and implement stores, beauty shops, and they can buy the substances. They can make their own bath salts. And I've got a recipe up here for bath salts if you want to see it. It's in the deal, what people actually use, and you'll recognize you have some of those as lotions at home. Some of those things that are nice for our body.
How do you ingest bath salts?
How do you get it?
How do you ingest it? How do you ingest it? What do you?
Oh, you can smoke it, you can inject it, you can snort it, you can put it in your buccal area, and some people are doing other creative ways that are extremely dangerous for it. It'll speed your heart way up. It'll give you panic attacks, and when you get panic attacks and you also have the paranoia, you get really dangerous and you don't know who to trust. It can be very intense, and there's a lot of violence that then takes place, and the rationality with police officers with the person who's high in bath salts like methamphetamine or spice is gone. It places our patients, it places our families at risk if they use bath salts. It's a complex chemistry, and it has changed over and over and over. These are some other pictures. Now, years ago, there was a certain kind of person that enjoyed going to raves or these big party places, and they would do what's called ecstasy. It started in England, then it kind of migrated to the United States. Ecstasy pills looked exactly like this. All those pretty little designs, those pretty little colors. Now the research shows that if somebody has a mental illness and they want to use ecstasy and they buy it on the street, if they've used ecstasy before and they know how to control their trip, 90% of it is now bath salts. And there's no controlling it. So then the person panics, they get anxious, they get angry, and they end up having to go back into an emergency room and sometimes to a psych unit. Okay? Or they hurt somebody bad and they go to jail. Okay. Now we have energy drinks. How many of you know what an energy drink is? Okay? When I talk to students at our university that drink up to 6 of them a day, and then I let them know that we have had people overdose to try to kill themselves, and it took only 7 a day for them to have to be intubated. In an emergency room. It took a long time to recover, and their brain did not recover. We know now that energy drinks can cause a cardiac arrest, can cause headaches and migraines, can cause increased anxiety. I use an energy drink to get energy. I have anxiety, and it causes my heart to speed up, and I got this little heart condition that every now and then I'm going to have a little gallop, I'm going to have a little flutter. Now I'm wondering if I'm having a heart attack from energy drinks, and I panic, and my family can't control me. Insomnia, related to new onset, but family genetics of type 2 diabetes, can cause severe problems with drug interaction and can cause addiction. Energy drinks have approximately 5 stimulant drugs or amino acids in them. There are actually energy drinks, we know that junior high kids who want to get high and stay high from energy drinks can actually go on the web and get a calculator. They can put in their gender and their weight and how many energy drinks they have to have in order to feel excited, and how much they have to drink every couple hours to stay high and fun. But it'll also tell you what is a safe amount for you to use in one day. And if you use that in one day, don't use them for a week or so. Okay?
Oh.
There's a new energy drink out called Organic Rockstar. It's got 2 stimulants in it. Real sugar, organic kinds of yohimbe, which is a stimulant. Seems to be much better, but people say, no, it tastes more like ginger ale. It doesn't give me that rush that I want. And it can cause risky behavior, jitters and nervousness, vomiting, allergic reactions, high blood pressure, and some people get that niacin overdose. Do you know what a niacin overdose feels like? Imagine you got 1,000 pins and needles in your arms, your skin all of a sudden becomes really flush, and you feel like your body and your stuff is moving inside, and it's just, you don't know if you're dying or you're thinking, boy, I'm having a great body trip, and some people like it, but some people panic with it, and they strike out and they hurt folks. Google niacin overdose, how much niacin you have to take to have that adverse reaction. It's a normal reaction to niacin. Yes, sir?
I'm sorry to go back just a minute, 30 seconds, whatnot, but do you mean yohimbe bark or just yohimbe?
You know, there's 2 different kinds, 2 different ways the yohimbe bark is used and the yohimbe scrapings are used, depending on which kind of medicine. But yohimbe bark, when they use it in energy drinks, it's not standardized. Some might have such a massive amount, it creates almost an amphetamine or methamphetamine type reaction in some people. Yohimbe bark is used as a very great medicine for men who have an erectile dysfunction. For people who have back pain that need a little bit of extra energy, it gets them through that. But it can be very, very dangerous. Okay? Have you ever seen yohimbe bark on the trees?
I've seen in literature.
Yeah? Oh, it's really a beautiful plant. And it can cause a stress hormone release. Okay, these are energy drinks. Now, I really want you to know we have 2 kinds of energy drinks, and I'm going to talk about those in a minute. 2 different kinds of energy drinks. And we have Ecstasy. It's a synthetic psychoactive drug that is stimulant and hallucinogen kind of properties, similar to methamphetamine and mescaline. But people that are using it now, if it's not the original formula, will have the stimulant and the methamphetamine reaction. They won't have the trip that feels good where they expand their consciousness. They just get angry. Those are some pictures. We've seen that one before. This is the original drug that bath salts are made out of. This drug was actually sold in the marketplaces to fund ISIS originally. It was captured, synthesized, really got big in England and other places. It's native to East Africa and Southern Arabia. It is almost as common in those places as chewing betel nut is to the people in the South Pacific, which is a mild stimulant that helps them work more. This helps them work like a caterpillar tractor, with energy, with verve. I can get it done. And it can be very dangerous. Some more pictures of it. There's that ivory snow bath bar that used to be on the market a lot, and that's where the bath salts came from. Okay, spice, mainly abused by smoking, alone, or in marijuana. They also be prepared as an herbal infusion for drinking. Drinking, you get a different kind of high than you do if you smoke it. There are 5 active chemicals most frequently found in spice. All of them are scheduled drugs. It's not legal to make them, possess them, or use them. South Dakota has a law that if you have methamphetamine in your urine, you can be arrested for possession of methamphetamine. It used to be a felony, but it's not anymore. Okay. These are the main ingredients for the people, including the people in northern New Mexico that I've talked to, for making their homemade spice. Acetone, it's a solvent, it hurts the brain. If you like to do any inhalants, don't use acetone, it's not good for the brain, but people ingest it. Tobacco or herbs, Abrobascus, cincutum, marshmallow leaves, damiana, wild opium, wild marijuana, skullcap, and spearmint menthol are used. It's put together, it's ground together, it's mixed together. Sometimes it's made with a particular heat where an oil is extracted from it. Okay? Most of us would think that our family member who's got schizophrenia or bipolar disorder, most of us would think that they cannot put this together. But they can. They can make their own.
Excuse me.
Yes?
Does acetone, does it separate something from meth that shouldn't be there or is more dangerous or something?
It actually, I just recently went through a special program on suicide bombers, and it's also used by suicide bombers because it does cause things to separate. It is also used in Nazi labs. I've taken them apart when I was a police officer in trunks. We have places where I came from that acetone was one of the things that were used along with certain kinds of other things that are combustible that the earth burned for weeks after the lab blew up. So you're right.
So then if they use acetone, like say, to separate something from the meth, then acetone will evaporate with whatever it separated, or what?
If you're a good cooker, you hope so. But a lot of people aren't a good cooker, and the instructions aren't real good. I hate to say it that way, but a lot of people make mistakes when they are making these things. Somebody was making a high-potency THC while they were driving on the front seat of the car next to them. They had been using some of that same substance that they were making, and they were so psychotic, they weren't even staying on the road, and it kind of burnt their car up. It's kind of like people that cook that aren't chemists. They can hurt themselves and their family. Sometimes family don't understand, too, why their child, young male or female, who's making something, ended up with burns on their arms, and they said, oh, I spilled something on it when I was mowing the lawn or something. Where they actually have a caustic burn from one of these substances. I'm thinking that's probably answering your question.
Yes, thank you.
Okay. Cannabis, some lightweight symptoms for the most part, but in spice, we see seizures, we see problems with calcium and sodium, we see hypertension, high blood pressure, nauseousness, agitation, violent behavior, and coma. And it is generally the nurses in the emergency room that put one and one together and say, hey, I've got to find out, is this person here using spice? Because this does not look like a physical condition and their urine is clean. Spice and bath salts do not show up in toxicology urine tests in emergency rooms. Hospitals can get them, but they're expensive. They just don't, unfortunately. Physical dangers of synthetic drugs, okay? I guess we lost the physical dangers, huh? Okay. Everything all the way up to strokes now, brain bleeds, psychoses, and violence. These are our alcohol-based energy drinks. Some of us in here are old enough to remember Red Bull when it first came out. In 2004, it had an ingredient in it that was banned. And that ingredient was ephedra. It was banned, and ephedra is the main ingredient, or an extremely similar ingredient is used in making methamphetamine. So instead of methamphetamine or ephedra now in it, there are other substances that are stimulants, including yohimbe or guarana or some of the other very powerful herbal stimulants. In alcohol-based energy drinks, we know that people who use these and end up having to be into an emergency room, only about 1 out of 10 will have to go to a psych unit because of the bad effects of the energy drinks. For people that go to emergency rooms because of their energy drinks that don't have alcohol in them, closer to 5 to 8 out of 10 may need to go to a psych unit for psychoses. There is something about the alcohol in the energy drinks that helps reduce the likelihood of somebody who has a psychotic mental illness or a history of it, or to be drinking too much and have psychosis on its own, to end up having to be intervened by medical folks. So an issue is for families, if somebody likes energy drink, Mom, will you buy me an energy drink when you go to the store? Give me an NOS. Give me a Colt. Give me one of those Zion drinks, please. It makes me feel good. I can work harder around the house. I can even go back to school. And then you start noticing there's all kinds of empty bottles of energy drinks or empty cans of energy drinks. That's a warning sign. Okay. Okay, facts regarding THC. Did you know that the average levels in 2003 was 6.4% of the active ingredient that people use to get high? Was 6.4. In 2018, most estimations were above 15%. Do you know of any product that you can buy right now legally in New Mexico that has a THC content above 85%? Yes, I'll tell you about. Do you know of them?
Is it a THC pill?
It's actually not, but soon they will be here.
Oh my gosh.
Okay. I've got a friend who says, you know, I'm going to my 710 meeting. You know what 710 is? OIL. I'm going to an oil meeting. I'm going to a wax THC meeting, a Rick Simpson's oil meeting, or maybe I bought a wax. I can make one at home with what I buy from Amazon for $19.95. I can make a concentration of marijuana that is 85 to 90% at home. And I smoke it, I create an oil out of it. You can buy them in pharmacies. You can buy the actual oil in pharmacies. Now, if you would, think about what 95% THC would do for somebody's brain who's never had a supercharged cannabis high. And all of a sudden they use this for the first time, and not only do they feel euphoric, but it feels as if every cell in their body is smoothly communicating with other ones. And there's a lot of different descriptions that I hear people who use this say. And there are, of course, some of the people that we have in our houses that have severe pain, that also have depression or PTSD. A small amount of this oil could be very therapeutic. Okay? We also know that it's illegally made in areas in northern New Mexico, brought into our cities and sold fairly cheaply. But occasionally it will have a substance in it that will create an adverse reaction, because it's more than marijuana, it's more than some of the things that they use to extract liquid from it and turn it into what looks like a frosting, what looks like a honey, crystallized honey or propolis, liquid kind of propolis. It's really intense stuff. We have powdered crystals called keef. We have dry crystals. Whoa, I'm missing some things there. We have different things. This is actually a hash. Rick Simpson's oil is up there. That's what butane hash oil, BHO, sometimes called wax, may look like. there's rosin, different kinds of things. These here are all high THC. These here will vary. There's a handout there that talks, it's a marketing deal from one of the marijuana sites that talks about all of the good stuff about marijuana. And what you'll discover is that actually teaches people, because psychologists or physicians or psychiatrists that write for medical cards maybe don't tell the person that they're writing for medical marijuana what they need for their disorder, which would be most helpful. So we have lots of folks that are experienced in using marijuana or cooking it or making it that actually talk about the benefits of certain things that supposedly work for the disorders now that are legal to be used to get a marijuana card. So these are types of cannabis. Did you know that there are almost 800 strains or more of cannabis now from the original tree and hybrids? Isn't that exciting? Which am I going to pull from? Am I going to have Blue Dream tonight, or am I going to have Chocolope? No, I think I'm going to have some Afghan Kush. No, I want Gem Shaw, because that's 35%. No, that's only 29%. No, I'm feeling really anxious. I'm going to have California Sensibilia hybrid with Kush, with chocolate and vanilla hybrid. Oh, I want a vape pipe for that too. I don't want to burn my lungs. Now think about this. For those of us that have mental illness, and if we really wanted to feel better because we're not liking what's going on, when we read about what that's going to do to our mind and our body, mixing in with our spirit, that can be really inviting. Can be really inviting. Yes, ma'am.
So we're starting to see something that just came up, and it was related to this, and I only heard about it in the past several weeks, but from psychiatrists and then from staff at the guidance center. Something that they're calling dabs.
That's wax.
Yeah, okay, that's wax.
Yes.
Okay, so dabs and mushrooms in several, more than a few different stories have actually taken a normal young man, and we've ended up with a long-term psychosis. That if we push them into it, and it was the mushrooms. I mean, the mushrooms started it, but then what we're seeing is the dabs does the same thing.
Dab can do the same thing. It's called dab, chatter, splatter. It's got all kinds of different names, and I think there's some of those names in the other little article that I have there. And you're raising a great issue.
It's actually generating mental illness.
It is damaging people who have ever experienced a psychotic break. It has damaged people who might in the past been able to use some marijuana in a low-risk way. I'm not sure that today anymore I would even believe that marijuana can be low risk, because we know that kids before the age of 16 who start smoking marijuana daily are more likely, 3 to 5 times more likely, to have a psychotic break or a suicide attempt by the time they are 24 or 25. And now we know that people who are using those same things, there's some new studies. This article that I'm giving you is from a marijuana site that talks about the goodness. Now the journals are actually doing studies and reporting studies that's showing marijuana is extremely dangerous, especially for people who have certain physical disorders or certain mental health disorders.
Do you have a feel for, how much of psychiatric disorders are psychiatric disorders? How much are substance-induced psychiatric disorders? And, how much are both?
I'm doing some research. Anticipating a question like that, I took a look at every one of our, not only here, but I've got people in other places that run mental health centers, taking a look at every one of the disorders that had psychoses. We are finding over 60% have a stimulant-induced psychoses after the first diagnosis with psychosis that are coming into certain hospitals now. Here's the problem. In the 60s and the 70s and 80s, looks like a duck, walks like a duck, quacks like a duck. Yes, this is schizophrenia. Without the questions of were there drug use, drug problems that created it initially. And when a person doesn't get better after they quit using it, they still have the psychoses. Mental health usually believes, yes, we have a true psychotic disorder here. It may not have started that way, but it's going to stay that way. So this is the symptom that's in front of us. This is that human spirit in front of us. Now, how do we treat that human spirit? It's not always drugs. Sometimes it's support groups. Sometimes it's PSRs. Sometimes it's other organizations. Sometimes it's churches. Yes, ma'am.
So how do mushrooms fit into what, when you're saying stimulant induced, or would mushrooms fall, where are they on this?
Mushrooms tend not to be stimulant-induced per se. They would more likely be if people, here's an example, peyote. Peyote with people who are part of the Native American church that actually work with a spiritual provider. They don't have psychotic episodes that generally stay with them. They just don't. But an old white guy might if he did. Peyote. Or we might have people that didn't have an integrated spiritual belief with a guide to help them understand what the visions are. They might have psychoses. The flashbacks with hallucinogens are very real. LSD causes flashbacks. Some people have flashbacks from LSA, and we have people locally that make LSA, which is close to LSD. Some hallucinogens, PCP, can have flashbacks. With mescaline and THC together. THC is mind altering. It changes perception. It changes time, color, shade, form. Hallucinogen is all made for changing and altering that because of the effects it has on certain receptors of the brain. So it takes a little bit of mescaline, a little bit of dab or something. They come together potentiating so the individual effects boost together and cause a much greater effect. Not enough research yet on that, Luce. And of course, it sounds like you're seeing that, as we are.
Oh,
Yes, sir.
can I clarify what PSR is abbreviated stands for?
Psychosocial rehab.
Psychosocial rehab?
Yeah, mental health centers have psychosocial rehab centers where people with mental illness can often come in and learn coping skills. Up where I came from, we had a psychosocial rehab that worked with just co-occurring folks, dual diagnosis folks. And it seemed like that works very well because other people who had drug and alcohol problems and schizophrenia or bipolar, they related to other people and they learned coping skills from other people, and sometimes their families would come in and talk about what they do to manage that. Yes, sir.
And can I also clarify if mescaline is the air sickness in the airplane, mescaline, is that the same as airplane air motion sickness?
No.
It's not?
No. And there's a whole movement on the internet that talks about the government likely seeding the United States with drugs. But that's very different.
Okay.
Yeah. I've read some of those sites. They're kind of interesting to read, but that's not, would not be mescaline.
Oh yeah, because over the counter in the bottles at all the grocery stores it says air motion sickness, but the ingredient is mescaline.
No, that's nurses. What's the stuff for the ear? MEC. It's the stuff that it blocks air with motion
It's a
sickness.
motion sickness, and I don't remember what it's called.
Starts with an M something or other.
Meclizine?
Ah, there you go. Thank you. No, it sounds like it, but it's not.
Okay.
Thank you. Good question.
Thank you.
Okay.
Vertigo.
Yeah, for vertigo. Meclizine. Not mescaline, meclizine.
Okay.
Yeah. So we have different strains, different wonderful names. And you know what? I like strawberry banana ice cream thingies. I would really like that if I'm going to smoke marijuana, I think. And people that go with the marijuana card into the stores, there's so many different names of different kinds of things. Some people fare very well from what they get, and they know if it'll work for them for their particular pain or PTSD. Okay. I'm going to talk a little bit about caffeine because caffeine is in most of our medications. It helps the medications work better. It's in coffee, teas, energy drinks, vitamins, chocolate, cold remedies, I guess I got vitamins twice, and analgesics. Caffeine can cause a substance-induced disorder called sleep dysregulation, and when it's severe, it used to be labeled sleep psychoses or sleep-deprived psychoses. Now it's generally called a substance-induced psychotic disorder or manic disorder at times. So there's the goodies. Yes, sir.
Real quick, can I clarify?
Yes.
And I don't want to take up too much time, but isn't chocolate more sugar than caffeine?
Oh, wait, sure. Yeah, I hope so. I like my sugar.
Like,
Yeah.
like sugar is like 16 calories a teaspoon. It's just sugar.
Yeah,
But, okay.
yeah. And you know there's 16 tablespoons of sugar in most energy drinks.
And you should try to get down in about 5 minutes. So
You got it, thank
little
you.
time for questions.
And there are some other really exciting drugs that we know kids make from their home medicine chemist. If there is some muscle relaxant or some anti-nauseous drugs, they'll mix it with Sprite. If they can get some codeine, they'll mix it with that. Mix it with any kind of cough syrup, and they make a drink. They add a Jolly Rancher and Sprite or Mountain Dew, and it's called Scissor. It's called Lean. Used to be legal in California. You could buy it. And we have some people that actually have used so much of it, they come in and they become nonverbal for weeks and weeks. These are the things that have this dextromethorphan, DXM, psychoactive drug found in common over-the-counter medications. You drink this, you get a really big high. We do know that the choice for our transient population for mouthwashes, for $1 to $2, you can get a big bottle of 56 proof alcohol. Most beers are max 26 proof. Low Point beer was 3.2% alcohol, which is 6.5 proof. Okay, active ingredients: thymol, eucalyptus, methyl salicylate, menthol. Included are water, alcohol, benzoic acid, polyoxymer fluorosebin, which is an inert substance, sodium benzoate, and caramel. There are warnings. If ingested, please contact a doctor. There's nothing in there that'll hurt you much. It'll get you drunk. It'll get you drunk. Now, if you take a bottle of the hairspray and drink that because it's got alcohol in it, there are neurotoxins in some of that. And some homeless people will do that just to try it out. Okay, abstinence. What, where, and how? And you know what? I don't think that one's going to come up. I talked about, and there's a handout there, the very last slide, what can be done to assist people who have co-occurring disorders. Let me just read them real quick and then we'll answer a couple questions to be done. Support 12 steps, NAAA, Cocaine Anonymous, outpatient individual group with oversight. With oversight would be this. Tom, Thank you for bringing your son in here. I'm going to ask, when we send him home from each group, every day you check and find out if he is using, check his room to see if he has got any leafy substance in his room, okay? It's harming him, we need you on board. That's what oversight is. Somebody in the community, somebody in the home to check. Residential treatment. We have many residential centers. Oversight means random checks. Everybody gets a urine test at least once a week, and every urine screen tests for synthetic drugs. Inpatient, we have a bit more control over that, but sometimes people bring things in. Sober living houses with oversight. A sober living house may be one where a person goes in, but we hear a lot that people bring in marijuana, they bring in meth, and trade it. Transitional living houses with oversight. And we're talking about, this is the way that people learn to control their substance addiction with their mental health concern. And then minimum use houses. There is, I understand, a minimum use house now in Albuquerque where alcoholics are allowed to have 1 to 2 drinks a night. It maintains them. If they don't get drunk, they don't have some of the same issues. They actually get jobs again. And then no use with family includes significant other. That is a rule that I have when I work with a person who wants to get sober. No use with family. If dad drinks a cocktail every night, no use with family. No use in front of our designated person. Oh, we forgot to tell you, dad's the person with the co-occurring disorder. We're here for support for dad or mom. And then the greater the number of support contacts, the more likelihood they will be okay. I put a lot of words out there. Do you have any questions? And you had some great questions, so thank you. Yes, ma'am.
Obviously, the co-occurrent disorder makes it difficult to figure out the chicken and the egg.
That's right.
And therefore, treatment is a challenge.
That's true.
Until, I mean, as a professional provider, I'm assuming that you first try to address the substance abuse because it's difficult to even get to the mental health issue until you can deal with more of a, pardon the expression, or more of a clean slate.
You know what? As a human being, one of the things I got to be honest and tell you is that sometimes when the substance abuse is treated and extended into months of recovery, a lot of families don't see the mental health behaviors. The mental health issue is still there, but the exacerbated behaviors from the substance use are often less. And then if a person has a relapse, we want to know whether or not a substance treated or triggered the relapse of the mental health issues. Sometimes it's easier to stabilize long term. It is easier to stabilize long term when there's no substances that interfere with the psychoactive medications. It's a great question. And some people say, no, the mental health problems will go away once you got the bipolar treated. It doesn't. We have to look at both. We have to have our eyes wide open. Are we over time?
No, actually, you have a question also from Facebook.
Oh, cool.
If you're ready. Someone says, I have a question for last year a book was published by Michael Pollan entitled How to Change Your Mind with the New Science of Psychedelic Teaches Us About Consciousness, Dying, Addiction, Depression, and Transcendence. What are the implications for dual diagnosis of increased interest in psychedelic medicines like ketamine for treating depression?
Okay. We have not only ketamine, we have ayahuasca and some of the other psychedelic drugs that are kind of experimental in nature. And even some of the researchers in Santa Fe have had really positive outcome with specialized populations. I'm not sure that they would treat anybody who had those, but somebody who was motivated, somebody that was medication adherent. The real relevant issue is we are on the frontiers in many ways of how the brain works and now have new mechanisms to see if our treatments are working. Not only new drugs that can be used, but also new imaging techniques that might tell us how a brain heals. That's a pretty decent book in writing. Yes. Yes, sir.
On page 2, we saw the 10 classes of substances,
Yes.
the alcohol, caffeine, and so on. I'm wondering, what happens, or maybe I could ask it a different way. People crave sugar oftentimes when they're using something, alcohol, and then they stop the alcohol, or the other kinds of drugs. I know meth also. So I'm supposing the sugar makes things worse. That's what I wonder.
Our brains get used to our toxic substance over time. As we withdraw and our brains heal from those toxic substances that could be in substances, then we have to look at nutrition differently. We have to look at replenishing the vitamins, the minerals, and the ways in which our body, mind and body, have been misused by reacting to a toxic substance. One of the people I had the privilege of working with years ago, sugar, 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 sugar. The only problem was people that had diabetes in it ran into problems. But he said, we're going to give enough energy until the body can redo itself and maximize its normal energy production. I wish there was a simple answer to that. If I had a meth brain, it may take me 1.5 years to get back to normal. If you had a meth brain, it may take you 2 months to get back to normal. Different bodies heal differently, and different bodies need different things. Not every person with a bipolar disorder should have the same medicine as everybody else, because it's symptom-driven, just like recovery is symptom-driven. And you're right, sugar craving is an issue for some people, but for other people it's a curative issue.
Thank you.
Yeah, good question, thank you. Yes, sir?
Do you or others do presentations like this to school groups?
You know, when I was up in South Dakota, we did like schools all over South Dakota like this, yes. I'm not sure what the prevention programs here are doing. If you would like to, I could actually call the alcohol and drug deal and get the information back to Tom, and he can get it to you if you'd like. I'll do my best to do that if you would like.
I think it would be, these presentation like this would be very useful for school groups.
Yeah. Thank you, you're right.
Not necessarily mental illness, but just generally to show the damage to the brain.
What we did with our college students is we trained college fraternity and sorority and athlete leaders to go out and teach their teams, and then we helped them develop what the perfect program was, what they thought the perfect program was for their teams. And we have student leaders as young as junior high, including our reservation schools and our detention centers. We taught them how to do the presentations, and we practiced with them before they would go in and do it. Yeah, thank you.
Any other questions?
Let me express my gratitude for allowing me to come and talk with you. You probably can tell I have a passion for trying to help people heal mentally and heal from substances.
And let us thank you for giving.